The emergency services in one Lawrence County community is leaving patients facing slower response times, and residents are saying they're afraid what will happen when they experience their next medical emergency. It's where we start. I'm Kenesha Dees. Last week, the Lawrence Medical Center announced it will close its ER and inpatient services. That will mean added strain on EMS operations within the county, as ambulances will have to travel 21 miles to the nearest hospital. The hospital is transforming because there just wasn't enough business to fully staff the ER 24 hours a day. And it's part of a worrisome trend for rural hospitals around the nation and in our state. They don't get the funding they need to take care of the county population, so those people have to travel to a bigger city to get medical attention. It's happened near Huntsville, Birmingham, and Tuscaloosa. Fox 54's Caleb Aguayo takes us out to Moulton to see how it's affecting Lawrence County.
All of us. Is it going to make them overburdened with so many folks?
That's the concern for emergency medical services in Lawrence County, a county full of people that might need to get to a hospital, but the nearest one will be a half-hour away in Decatur. Belinda Fike worries that when someone is finally on the way to an ER, the medical system will be so strained that they can't get seen in time.
Lawrence Medical closing its ER and inpatient service is part of a trend in rural Alabama counties. Hospitals close and the local ambulance service is forced to take patients to another city for emergency medical care. I talked with some of the people living in and near Moulton, and they told me medical emergencies can't wait 20 to 30 minutes to make it to Decatur.
It's extremely critical. Absolutely. Without a local ER, it's the life or death situation within 20, 30 minutes. Some things require less time than that, and having to go to Decatur or Huntsville it just puts a lot of people at risk.
For one man bitten by a venomous snake about 2 years ago, the risk was enormous. Local business owner Chris Brown says when he needed Moulton's ER, it saved his life. Without emergency services nearby, he may have died before getting the attention he needed.
I did get snake bit by a rattlesnake and wound up having to stay some time in the hospital. Wound up in Moulton first, where they started the antivenom, and then wound up transferred to Huntsville for a few days. It was very critical. They like to have the antivenom going by, I think, within a 2-hour range, and I think by the time I got bit and got to Moulton, it was like an hour and 10 minutes, an hour and 30 minutes.
With heart attacks, strokes, snake bites, and trauma-inducing car accidents all fairly common, those who live in Moulton say they need some kind of emergency care before it's too late. In Moulton, I'm Caleb Aguayo, Fox 54 News.
Definitely a challenge for the Moulton community. Well, Greg's ambulance service, which covers the area, was unable to respond to our request for comment. Lawrence Medical Center hasn't yet announced the closing date for its ER and inpatient services, but when they close, hospital officials urge residents to seek help in a nearby urgent care or face the ambulance ride to the Decatur Morgan Hospital.